Why do we see a rise in colon cancer rates across various age groups? This question has been echoing in the medical community for some time now. We're witnessing an unsettling trend, a surge in colon cancer rates, not just among the elderly, but alarmingly, in younger people too. Colon cancer is a formidable foe, ranking as the third most frequently diagnosed and the second most lethal type of cancer. Yet it's not just the disease that's complex. The industry built around it, often driven by financial motives, misleading advertisements, and abundant, confusing information, further muddles the scenario. This leaves both patients and healthcare professionals puzzled and often misinformed. One common misconception is that your risk for colon cancer is primarily determined by your genetics. Yes, it's true that a family history can increase your risk, accounting for 5 to 10% of cases. However, this is far from being the whole story. Indeed, genes may load the gun, but it's our lifestyle choices that pull the trigger. Modern research is increasingly spotlighting diet and lifestyle as crucial factors in preventing or even reversing this disease. For instance, foods rich in antioxidants are now being recognized for their role in combating various chronic conditions, including colon cancer. This isn't mere speculation. It's a rapidly expanding field of scientific research that's paving the way for the future of medicine. So, if we take a closer look at our lifestyles, our dietary habits, our physical activities, and our overall health choices, we'll see that we hold more control over our risk of colon cancer than we might have initially thought. It's not just about the genes we inherit, but also about the choices we make. This doesn't mean that the rise in colon cancer rates is entirely within our control. There are other factors at play, such as environmental influences, which need further exploration. However, it does emphasize the importance of lifestyle changes in mitigating the risk of this disease. While genes may load the gun, lifestyle choices pull the trigger. Let's remember this as we continue to explore the complex world of colon cancer and strive to turn the tide against this escalating epidemic. Colon cancer is the third most commonly diagnosed and second most fatal type of cancer. But what exactly is it, you might ask? Well, let's dive in and take a closer look. Essentially, colon cancer, also known as colorectal cancer, starts as a small cluster of cells that often begin as benign polyps in the lining of the colon or rectum. Over time, some of these polyps can transform into cancerous tumors. The danger lies in the fact that this process can take years to unfold, and in its early stages, colon cancer rarely causes any symptoms. This makes it an elusive enemy that can grow undetected. Now, if you're wondering what happens when these malignant cells continue to multiply unchecked, here's the grim reality. They can invade and damage nearby tissues, ultimately spreading to other parts of the body in a process called metastasis. This is why early detection is so vital. Catching colon cancer in its infant stages can drastically improve your chances of beating this disease. So, how do we go about detecting it early? Enter the colonoscopy. This medical procedure allows doctors to examine the entire length of the colon and rectum. If any suspicious areas or polyps are discovered, they can be removed right then and there for further testing. Regular colonoscopies, especially for those over the age of 50 or with a family history of the disease, are crucial in the fight against colon cancer. But it's also worth noting that this isn't the only screening method. Stool tests and flexible sigmoidoscopies are also tools in our diagnostic arsenal. Remember, colon cancer often begins as a silent invader. It doesn't wave a red flag to announce its presence. Instead, it grows quietly, slowly, and insidiously. This is why we need to be proactive, vigilant, and attentive to our bodies. Regular screenings and understanding your risk can make all the difference. Early detection remains a critical factor in fighting this disease. After all, knowledge is power, and in this case, it might just be the power to save your life. What are the early symptoms of colon cancer? How can you detect it early? These are questions that many people ask, and rightfully so. The symptoms of colon cancer can be elusive, often going unnoticed in the early stages. This is because colon cancer typically starts as a small, slowly growing polyp on our intestinal wall. Initially, it occupies minimal space and doesn't interfere with the intestine's contents, which is why it doesn't produce symptoms in the early stages. However, as the disease progresses, certain symptoms may start to emerge. Changes in bowel habits, such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days, can be a sign. You might also experience a feeling that you need to have a bowel movement that's not relieved by having one. Rectal bleeding or blood in your stool can also be a symptom. This is often not visible to the naked eye, which is why it's crucial to have regular stool tests as part of your checkup. Persistent abdominal discomfort, such as cramps, gas, or pain, can be another warning sign. A feeling of weakness or fatigue that cannot be explained by other factors such as lack of sleep or physical exertion could also be an indication of colon cancer, as the disease can cause a decrease in red blood cells, leading to anemia. Unexplained weight loss is another symptom to watch out for. If you're losing weight without trying, it's important to consult a doctor. This happens because cancer cells use up a significant amount of the body's energy supply, and the immune system also uses energy as it works to fight off the disease. The appearance of symptoms often depends on both the size and location of the tumor. That's why regular checkups and screenings are crucial for early detection. Remember, these symptoms are common to many other conditions as well, so experiencing them does not necessarily mean you have colon cancer. But if they persist, it's important to see your healthcare provider. Listening to your body and recognizing the early signs can be a lifesaver. So don't ignore these symptoms. Early detection is key to improving survival rates and outcomes. Can colon cancer be prevented or even reversed? This is a question that has sparked numerous discussions and studies in the medical world. The answer, while not absolute, is promising. Prevention and treatment of colon cancer lie heavily in our daily choices. Diet, for instance, plays a crucial role. Foods rich in antioxidants are known to reduce the risk of various chronic diseases, including colon cancer. These include deep-colored fruits and vegetables, nuts, whole grains, and even dark chocolate. Antioxidants help in fighting off the harmful free radicals in the body, which are known to cause cell damage leading to diseases like cancer. Another critical factor is regular exercise. Studies have shown that people who lead an active lifestyle have a significantly lower risk of developing colon cancer. Physical activity helps maintain a healthy body weight, which is essential in keeping the risk of various cancers at bay. However, while a healthy lifestyle can significantly reduce the risk, it doesn't guarantee absolute prevention. This is where regular screenings come in. Early detection is key in treating colon cancer effectively. Tests like colonoscopies can help spot polyps or abnormal growths in the colon or rectum before they turn into cancer. Removal of these polyps can effectively prevent colon cancer. Once diagnosed, the treatment of colon cancer may involve surgery to remove the cancerous growths, chemotherapy to kill cancer cells, or radiation therapy to destroy cancerous tissue. The choice of treatment largely depends on the stage of the cancer at diagnosis. In recent years, targeted therapies have also emerged as an effective treatment option. They work by specifically targeting the changes in cells that cause cancer, causing less harm to normal cells. In conclusion, while genetics do play a role, colon cancer is one disease where you have significant power to influence your risk. A healthy diet, regular exercise, and regular screenings can go a long way in preventing this disease. Remember, the best treatment is prevention. A healthy lifestyle can be your best defense against colon cancer. Let's summarize what we've learned about colon cancer. Foremost, we've noted a concerning rise in colon cancer rates, not just in older individuals, but alarmingly in younger people as well. This is a trend that needs our attention and action. We've delved into understanding colon cancer. It's the third most commonly diagnosed and the second most fatal type of cancer. It's essential to debunk misconceptions around it, such as the belief that your risk for colon cancer is primarily determined by genetics. While family history can increase risk, it only accounts for 5 to 10% of cases. Our lifestyle choices have a significant impact. Diet and lifestyle are key factors in preventing or even reversing the disease. We've also discussed the various symptoms of colon cancer. The disease often eludes detection for a long time, sometimes years, as it starts as a small, slowly growing polyp on our intestinal wall. Early detection methods include analyzing stool samples for hidden blood and undergoing colonoscopies, especially for those at higher risk. Prevention and treatment of colon cancer is an area where we can all exert some control. Consuming foods rich in antioxidants and maintaining a healthy lifestyle are steps in the right direction. Remember, colonoscopies are not just for detection, but also for the removal of polyps, preventing them from turning into cancer. Share this information with your loved ones, colleagues, and friends. Encourage them to be proactive about their health. If you or anyone you know notices any symptoms, don't hesitate to consult with a healthcare professional. It's better to be safe than sorry. Remember, early detection can make all the difference. Stay vigilant and stay healthy.